Hey guys, Dr. Adam Brittain here. Thank you for joining me for my very first official podcast. I'm very excited about this. I want this to be interactive. I want your feedback, and I love ideas for future podcasts and discussions. So before we dive into the medical benefits of hydrogen water, I'd like to talk a little bit about inflammation. Inflammation has got a lot of press recently and certainly has been getting press for quite some time, especially in the functional medicine world. If you Dr. Google inflammation, you'll read all you'd ever want to know on anti-inflammatory diets, cryotherapies, red light therapies, meditation. All these things have a place in lowering the rate of inflammation, I agree. But to truly know the mechanism of action of inflammation, how is it initiated? How is it prolonged? How is it reduced? You kind of have to dive into the medical literature and find out really how it works. I know that's kind of unrealistic for most folks to read medical journals. They're long and often hard to follow. But it's kind of what I do for a living. My patients demand of me to be on top of this information. So with that being said, we have to kind of realize that inflammation is a normal process. And it is needed for us to maintain our vitality, our homeostasis, our equilibrium. Without it, we wouldn't be able to get rid of dead and dying debris and make room for new cells and new tissue. So it is a normal process. It's the rate of inflammation that can become an issue, that can create a disease process or symptoms. When I travel the country talking about longevity, I try to simplify longevity by the rate of new cell turnover to the rate of inflammation. And I often describe inflammation and chronic disease and the aging process as a chronic illness as an iceberg, right? The majority of the iceberg is beneath the surface of the water, right? This is your baseline level of inflammation, your normal inflammation. Now, as the rate of inflammation increases, that iceberg gets closer to the surface of the water. And as it breaches the water and the tip of the iceberg emerges, this is your disease process, right? These are your symptoms. Someone could have an autoimmune condition and not know it because that baseline inflammation is beneath the surface of the water. But once that disease presents itself and breaches the water, that's when a diagnosis is often made. So keep that in mind. Inflammation is a normal process. Beneath the surface, your baseline inflammation. It's not until the rate of inflammation increases that the iceberg gets above the surface of the water and presents itself. So it's important to realize this first and foremost. So how does inflammation work on a basic cellular level? Well, all cells become damaged at some point. Well, how does this damage occur? Mostly through old age of the cell, right? Trauma, environmental exposures, benzene in the air, biologic exposures, bacteria or fungus and their toxins can cause damage to the cell. Well, how does it do that? Well, it increases the number of what we call oxygen-free radicals or reactive oxygen species. These things start to accumulate and cause damage to the mitochondria. Now, the mitochondria is the organelle within the cell. It's the engine of the cell. It produces energy for the cell. And once the mitochondria becomes weak and dysfunctional, the cell soon dies. So when this happens, when these oxygen-free radicals and these reactive oxygen species build up and cause damage, the cells will send out distress signals to the immune system. These distress signals are in the forms of cytokines or messengers or crosstalk proteins, often as they're described. And these crosstalk proteins, these cytokines, things like tumor necrosis factor, interleukins, don't concern yourself too much with the details. Just know that they're proteins that are messengers that send distress signals to the immune system. The immune system, in turn, sends out modulators, growth factors, things that promote angiogenesis or new cell growth or new blood vessel growth, to be specific, to lay the groundwork for new cells and new tissue, as I described earlier. So a normal process. So cell gets damaged, sends out signals to the immune system responds appropriately as it's supposed to. It's just when this rate increases, this rate of inflammatory response increases, is when we get into trouble with disease and symptoms. So as we know the very, very basic mechanism of inflammation, and how it works at a cellular level. Now I want to dive into hydrogen water and tell you how hydrogen water actually reduces the rate of inflammation. Now I'll talk about lots of things in future podcasts about that are scientifically proven. Everything I talk about is in literature to be scientific fact to lower the rate of inflammation. And it's important to know the mechanisms here because then you can relate, well, how does it keep that iceberg right below the surface of the water? So hydrogen water, what is it? Well, a hydrogen molecule consists of two hydrogen atoms connected by a covalent bond. Very stable, it's very small, very lightweight, it's inert, and most importantly, it's nonpolar. And what does this mean? Well, nonpolar means it has no charge. And we have to keep in mind that the cell membranes of our cells and our mitochondria are very lipid soluble, very, very lipophilic, or they're very fat loving. They consist of fats and phospholipids. So the fact that this hydrogen molecule is inert and nonpolar makes it very lipophilic. And this means it's able to cross the membrane very easily. And this is the property that makes it a very, very sought after and very effective therapeutic modality. Okay? So that's the basic structure of hydrogen. Well, how does it actually work once it gets inside the cell? As I said, it crosses the cell membrane easily. It's got very good bioavailability, which means when you drink the hydrogen water, it stays very stable within the acidity of the stomach. It doesn't break down. And it gets absorbed into the bloodstream very easily. The biokinetics are quite good. So once this hydrogen molecule reaches its target within the cell, most specifically at the mitochondrial membrane, it actually acts as a very strong reducing agent. All right, what does this mean, reducing agent? Well, a reducing agent is something in chemistry that actually donates a hydrogen or donates an electron, more specifically. So what it does is it seeks after these reactive oxygen species, these reactive free radicals, and it actually donates a hydrogen, donates an electron, and it neutralizes these toxic entities that are causing damage to the mitochondrial membrane. So it neutralizes these reactive oxygen species and these oxygen-free radicals. That's the first step in the mechanism. There's a second step. We don't know how it does this specifically, but it actually interrupts and intercepts this crosstalk, these cytokines, the crosstalk between the dead and dying cells and the immune system. And it inhibits the crosstalk. Very similar to biologic medications. Now, biologic medications are monoclonal antibodies. Sometimes you'll see the commercials on TV, everyone running around having a great time doing fun things. But you know it's a biologic medication because there's an AB or an IB at the end of the name of the medication. These are monoclonal antibodies that are developed specifically to bind to these crosstalk proteins, these cytokines that are imperative in the immune process. That's why people who are on biologics often are quite immunocompromised because parts of the immune system are disrupted and they have to be tested for TB and things like hepatitis before they initiate these medications because they can cause issues with infection, with chronic infection specifically. So very similar to the mechanism. We don't know the specifics of how this hydrogen water intercepts these crosstalk proteins or these cytokines, but it's been shown to disrupt this messaging system. So not only does it neutralize the free radical, right, it also disrupts the messaging system between the cell and the immune system. So the immune system never knows it needs to start the process of inflammation. So these two mechanisms actually decrease the rate significantly of inflammation. And I want to cite a couple of, actually three really interesting studies. The first study, most studies looked at either the pain or analgesia pathways or inflammatory bowel disease, things like Crohn's disease and ulcerative colitis. One study showed that the hydrogen water significantly decreased the level of inflammation within the colonic epithelium of these ulcerative colitis patients by drinking hydrogen water through the mechanisms I just described. Another study looked at diabetes type 2, the development of some pre-diabetic patients with their hemoglobin A1Cs approaching 5.7, actually transitioning into full-blown type 2 diabetes. It showed that drinking up to 1.5 liters of hydrogen water a day significantly reduced the rate of transition into full-blown diabetes type 2. We know that metabolic disease causes all kinds of damage to cells as well. You know, pre-diabetes, hypertension, visceral fat, all the metabolic type disorders and symptoms and symptomology that leads up to increased rates of diabetes cause damage to cells. So this hydrogen water actually prevented the transition into full-blown diabetes type 2 by reducing the levels of inflammation within the cells in these pre-diabetic patients. And of course, my favorite study on longevity showed there's a protein in all of our cells called NRF2. This NRF2 is like the gatekeeper of the cell. It's the main protective mechanism of the cell. It protects and detoxifies these oxygen-free radicals and these reactive oxygen species. This study on longevity showed that hydrogen water actually potentiated this process, this mechanism, made this mechanism of NRF2 more efficient. It didn't increase the number of NRF2 proteins, but it just made the overall mechanism more efficient. So a very interesting study on longevity that came out quite recently. Let me now talk a little bit about how to make it. And this is, I'm not necessarily promoting this machine, but this is an excellent machine. This is my machine. I do this every morning. This is part of my morning regimen, making hydrogen water. Like I said, most of the studies looked at 1.5 liters. I usually do one bottle, which is a third of that, and I'll do another bottle in the evening. So I'll do about 1 liter total daily of hydrogen water. So quite easy to make. Again, this is an excellent machine. This machine in particular allows you to electrify or magnetize the water. First, it spins it for about 10 minutes and magnetizes it, and this stabilizes the hydrogen molecule, which is quite important in terms of storage and how long it'll be stable within the solution. So that being said, also the less water you add to the canister, the more concentrated the hydrogen water. The more water you add, the less concentrated. So I would usually press the button once for every 500 mils of water that I add, okay? Which is 1 bottle water amount. So to do this, we just turn the machine on, we open the canister, and like I said, I just do 1 bottle in the morning and 1 bottle in the evening. But open up a fresh bottle of bottled water, doesn't matter which kind, obviously. And once you do this, turn it on and you magnetize the water. This spins the water. As you can see, the water now is spinning and providing a magnetic charge to the water. This goes on for 10 minutes. I won't bore you for 10 minutes on this process, but once it spins and magnetizes, it'll stop, and then you turn it back on and press the hydrogen infusion button. Now you can't see this from where you are, but I can see a hydrogen molecule and hydrogen gas being aggressively infused into this water right now. So this lasts about 13 minutes or so. So the whole process is about, it's certainly 20, 25 minutes. So this could become a rate limiting step for you in the morning. So make sure you leave enough time to do this. It doesn't happen right away. Now some canisters will add the hydrogen as you go. This is a machine that kind of requires you to do it at home and do it before you leave the house. So again, make sure you leave enough time to do this. But once this hydrogen is infused, it takes about 13 minutes. It'll stop. Now the most important thing, don't put it back in the plastic bottle because the hydrogen can actually leach right back into the plastic and through the plastic. So use one of these aluminum canisters. These aluminum thermos are quite good. This stabilizes the hydrogen and prevents it from leaching out and keeps the hydrogen where it's supposed to be, within the water, dissolved in the water. So like I said, once this ends, you just simply pour it into the canister and you're ready to go for the day. You can take it with you, you can drink it there, you can make another canister if you want of hydrogen water. Now if you pour 2 bottles in here, up to 1 liter or so, I would press this hydrogen button twice to make sure the concentration of hydrogen water is appropriate. So that's kind of how you make it, that's how you store it, and it's part of my everyday regimen. Like I said, it makes a huge difference in my overall health. I can tell a big difference. My patients can tell a big difference in their overall energy level, their recoveries from their exercise routines, things of this nature. So I hope you learned something today. I think I only talk about things that are medically relevant and in the literature as being scientific fact and backed up by scientific evidence. I try to keep the discussion short and sweet, about 15, 20 minutes or so. There's a lot of great podcasts out there, you guys. Really terrific podcasts that are 2, 3, 4 hours long. Unfortunately, I just don't have that much time to sit down and listen to a discussion unless I'm on a long flight or something. But I try to condense it, very information packed, short and sweet, that you can really watch it, digest it, and move on to something else. So I hope you've enjoyed this. I think it's going to be a learning process, like I said, for you, but also for me as well, with your feedback. Our next discussion is likely to be on Alzheimer's dementia, some of the genetic predispositions for Alzheimer's, some of the clinical diagnosis, how the disease progresses, the mechanism of the disease process, and most importantly, some of the top supplements and some of the lifestyle modifications that can actually slow down this process and actually even sometimes prevent the process from getting to a point where it becomes an issue as you age. So I hope you'll join me. I'm very excited about this, and stay tuned for our next discussion. Take care.